Good evening. As of today, we're vaccinating in 73 hospitals across the UK. Tens of thousands of people have had the jab, and I want to set out the next steps. I can confirm that we'll shortly expand our vaccination programme further to 10 more locations in England, and from next week, we plan to begin vaccinations in GP-led sites and vaccinate in care homes by Christmas. We'll keep on expanding this rollout to reach more and more people. As more vaccines come on stream, we'll open vaccination centres in larger venues like sports stadia and conference halls next year, and that's when most people can expect to get their jabs. And even if you've had the jab, you're not immune because the vaccine will not fully protect you until 7 days after you've received the second dose. And we don't yet know if it'll stop you from passing on the disease to other people. So we have to all keep acting as if we can still pass it on, and that is the safest way to get the number of cases down and keep people safe. I'm particularly concerned about the number of cases in London, Kent and Essex. Cases are rising and in many areas already high. Looking into the detail, the testing results and surveys show us that by far the fastest rise is amongst secondary school-aged children, 11 to 18 years old, while the rate amongst adults in London is broadly flat. But we know from experience that a sharp rise in cases in younger people can lead to a rise amongst more vulnerable age groups later. We've seen that happen before. So we need to do everything we can to stop the spread amongst school-age children in London right now. Having spoken to the leaders of London's councils and to the mayor, we've decided to put in place an immediate plan for testing all secondary school-age children in the 7 worst affected boroughs of London, in parts of Essex that border London, and parts of Kent. We want to keep schools open because that's both right for education and right for public health. We're therefore surging mobile testing units, and we'll be working with schools and local authorities to encourage these children and their families to get tested over the coming